Continuing our team coverage tonight on the coronavirus outbreak. During these uncertain times, we are working to help answer your questions about the outbreak. Channel 3's Kara Sundland spoke with a doctor today about what we should all be concerned about.
Is it true that people should not be taking ibuprofen if you happen to be self-quarantined? If that is true, what over-the-counter medicines can you safely take to combat this virus? Because there's so much different information out there.
Yeah, I think if you have to take anything, I would say first, maybe you don't have to take anything, but if you really feel a lot of aches and pains and you feel you should take something, there have been some concerns raised about ibuprofen. I'd probably stick with the acetaminophen, Tylenol products.
Okay. And what about takeout food, grocery shopping? Can someone with the virus pass it along by touching our food packaging, or are we okay to just take that takeout?
Well, I think it's something in between. I think any vector, any fomite, any solid surface is a potential vector of any disease, right? I think it's fairly unlikely you're going to get something on a styrofoam packaging, but I think people should use precautions. I think use hand hygiene. If you're going to open a package, then wash your hands before you eat.
And should we be changing or washing our clothes right when we come home?
You know, I haven't seen any clear recommendations for that, honestly, but I do think you have to kind of do what makes you feel comfortable. I think I work in a healthcare environment, so maybe for me that would make more sense than someone who works anywhere else or is just at home. I think if you're working in a low-risk area, I just don't think that makes a lot of sense.
And what about, same question in that same vein, should we be taking precautions when opening the mail?
Yeah, again, it's another one of those. I think how long you have to go through the math of, even if someone touched a piece of mail, let's say the mail delivery service, someone in the post office touched it who had the infection and had coughed onto their hand, then you come down to the question of how long will that virus live on that dry piece of mail that's been transported over days and hours, many hours and days to get to you. I think, again, the risk there has to be minimum.
What's the latest advice if you're pregnant?
Yeah, I'm an obstetrician by training, actually, and I think pregnancy, typically people say it's a little higher risk for getting sick because, you're pregnant and that's a challenging time in general. So I think people have suggested that pregnant women take extra precautions, but it's actually really no different than we take during influenza season again.
All right, doctor, thank you so much for your time. And also, please pass along our thanks to all of your healthcare workers who are on the front lines for us during this time.
Thank you, Kara. That's what we're here to do. Thank you so much.
Thank you.